Asthma is the topic for today. We are going to see 5 questions and answer them, where we have to define asthma, the causes, risk factors. We need to see the signs and symptoms. We'll see the consequences or complications. Then we see treatment and prevention. Now we start with part 1 because the asthma is a broad topic, so that we can have a better understanding. Where in part 1 we are going to see the definition and the causes or risk factors. We are going to concentrate on the respiratory tree. See the trachea going down to the lungs. That's where our focus is. What is asthma? Asthma is airways narrowing. It is due to underlying inflammation or swelling. It will be having increased mucus production and contractions of the muscles around the airways. That's what we call bronchospasm. It can be secondary to genetic characteristics, occupational exposures, or environmental factors. Now we see the trachea going down to the bronchi, trachea, bronchi, and bronchioles. They are the one which will be affected by that inflammation, swelling, and then it will cause a difficulty in breathing. It is a chronic disease of the airways. It will cause wheezing, breathlessness, chest tightness, and nighttime or early morning coughing. The causes and risk factors: if a family or a parent has asthma, it is more likely that he or she will give it to the child. That is a genetic characteristic. These are the DNA. You can see the DNA, which has many small particles, the genes. If just one gene of this is a carrier of asthma, asthma characteristics, then it will be transmitted to the baby. The baby will have eventually in the future asthma. So what we call atopy, the one which is common in children, it refers to the genetic tendency to develop allergic diseases, allergic reactions. And these allergic diseases will be like asthma, or what we call allergic rhinitis. Rhinitis is an inflammation of the mucosa in the nostrils, where you will be having running nose due to allergies. Or it can cause what we call atopic dermatitis or eczema. It's an immune response to the common allergens. Now, when you check a baby who has this kind of reactions on the cheeks, we call it atopic dermatitis, eczema. This child will most probably develop asthma in the future. Other risk factors is environmental exposure. You see, if you are working in an environment like this, you constantly breathe this kind of air and you are prone to develop asthma, then the development will be, and it won't take long to develop asthma. If you are in the farm and you are breathing these chemicals that are constantly sprayed in the farms, environmental exposure. Exercises, if you are prone to develop asthma, there is what we call exercises-induced asthma, which will be a narrowing that takes place like about 5 to 20 minutes after the activity. Now, it is present in a vast majority of individuals with asthma. It's very common. One way of controlling it is to encourage people to warm up before exercises. They warm up a little bit so that they can control it. There are other triggers, risk factors, like allergens. We know pollen, the small particles on the flowers, molds, dust mites, cockroach droppings in the house, animal dander from feathered, furry pets. Let's see them. The flowers have small particles on it. The bees like to come and collect them for their fabrication of nutrients and honey. But now, if you breathe them in and you are prone to develop asthma, it will create a reaction to the respiratory tree. Then asthma will start again. Asthmatic attack will take effect. So if you have a plant, flowers near your windows where you sleep, and you are asthmatic, then it will be very hard to control asthma with that tree near your window. If you have molds in your house, then it will be very hard to control asthma because the triggers are with you. You stay with them. If you have cockroaches in the house, their droppings will be the trigger of your asthmatic attack. Animals, the pets in the house, if you are asthmatic, these are not good for you. They will be releasing some small particles that you don't see. The animal dander of these feathered or the hairs of these cats and dogs. You breathe them in, then they causes a reaction immediately. Or strong chemicals, even perfume. If you breathe them in, then they will trigger the reaction. And air pollution. Really, even people who are not asthmatic, people who breathe this kind of air, in the short time or long time, they will develop a serious respiratory problem. Smoking is the enemy of the person who smokes, not only the one who smokes, but also a second-hand smoker. This will make asthma worse. So we need to remember about this. So there are other triggers like chest infections, weather changes, strong emotions, and cold air. These are the risk factors that will cause asthma to be worse. Thank you for the presentation, part 1. Part 2 is coming, where we are going to see complications and modes of diagnosis and treatment. Thank you.